All right. So for all of you attending, this is new for us. I hope everybody, enjoys this and we can answer some questions and tell you a little bit more about the PPEC model and, how we do things, not just at Tender Care, but just in general for, anybody interested in these services. Hello. Thank you for joining. All right. So we've got 62. Is that right? We go ahead and get started. All right, so I'll go ahead and introduce myself. I am Thomas LoBianco, and I am Vice President of Tender Care PPEC. And along with us, I've got Aurora Miller and Rebecca Gilmore. And it says Rebecca, but I call her Becky, so I might refer to her as Becky throughout the presentation. But she is one of our Director of Nursing at our Dunellen facility. She's been with us, 6 years now?
7.
7 years.
7.
So she's got a lot of experience as far as, the nursing aspect of this. And that's why we brought her along, because figured it'd be a good opportunity if you had nursing questions. I can answer most questions, but when it comes to nursing, she's the expert. All right. So let's see, 64 attendees. Well, thank you everybody for attending. And we welcome you to learn more about the PPEC model, and I've got a short presentation we'll go through. And if you have any questions throughout, please put them in the chat box, and then we can answer them as we're going through the presentation. And then we'll also have a time for a Q&A at the end. And hope you guys find this helpful. And bear with us, it's our first time. All right, so I did a little introduction. I did introduce Aurora. She's not pictured on here, but she's going to help with letting us know what questions are asked. She is my assistant, and she is phenomenal. Anything tech, anything related to social media, a lot of the stuff you see us put out, she's in charge of, and she's been a fabulous help to me. So we'll go ahead. Here I am. Here's Rebecca, and a little brief history on her. Before she got involved in being our Director of Nursing, she was an RN at our facility, and she came from the medical foster parent world, where she had, how many years experience did you have with that?
Sorry, trying to unmute. I was a medical foster parent for about 6 or 7 years as well.
Okay, so when it comes to medically fragile children, she has a wealth of experience, and she's phenomenal at coordinating the care, as we'll talk about a little bit further in this presentation. So a lot of you, I don't know what areas you're from or like what you're familiar with what PPEC is. You'll see it a lot. A lot of companies go by it, but what PPEC actually stands for is Prescribed Pediatric Extended Care Center. We allow medically eligible children to receive nursing care in a non-residential setting from birth to 21 years of age. While they're with us, it's a lot more than nursing care, and you'll see that as we go through the presentation. It's a lot of coordination of care, therapies, and socialization for the children. We pride ourselves on, being able to show up every day. We're not going to call out, and outcomes. The children receive therapy while they're with us, and the outcomes with the therapy are phenomenal. So, what does a PPEC entail? It's called Prescribed Pediatric Extended Care. That's because it's got to be prescribed by the pediatrician or one of the specialists of the child. And while they're with us, we can care for them up to 12 hours a day. All of our centers except one are currently open Saturdays. There are centers throughout the state of Florida that some might be open 7 days a week, and some might only be open 5 days a week. We offer Saturdays for those families that they might have other children in sports, or they have different things to attend on the weekend, and we give the family a safe place they can trust for their child to go to, and knowing that they're being cared by nurses, and it's a place you can trust. Let's see. we get 65. So here's some common diagnoses and things that qualify for PPEC, and it all starts with the pediatrician or a prescribing physician. Trachs, vent dependent, feeding tubes, seizure disorders, cerebral palsy, diabetes, oxygen dependent, apnea monitoring, brain injury, severe asthma. There's a lot of different things that also qualify if they require that skilled nursing service. Brief little story with me. I've got twin girls that are currently 5, and they started at one of our centers straight from the NICU. They were transitioned to our services as like a monitoring to make sure everything was going well with them and to provide that care in between being discharged from the hospital and going home. So one, you have that support from nursing. Getting discharged from the NICU can be a scary thing, especially when you were in there for an extended period of time. And when we're able to help support the family and support the child, it can go a long way. My girls no longer qualify for our services, and they're both doing phenomenal going into kindergarten. They just graduated VPK. So there's a lot of other diagnoses that could qualify. Becky, did I miss anything with that?
Now maybe preemies. So we see our fair share of, like you said, children who are infants that are just being discharged from the NICU, which a lot of time is preemies, and they'll have some bronchopulmonary dysplasia. So that leads to oxygen dependency. There's a zillion conditions out there that come along with that have skilled nursing needs associated with them. So it's really an individualized basis that that we take a look at these children and what their needs are in terms of will they qualify for services or not.
And on the bottom it says, unfortunately, autism alone does not qualify. But if they have autism with another diagnosis that needs the skilled nursing, they can qualify for services. We've seen a fair share, and we try to build relationships with other community members that serve the autistic community, because we hate saying we can't service, and that's not up to us. All of our children are qualified through a Medicaid authorization source. It's a third party that does all of our authorizations, and they do look at it pretty closely, but with the help of a good nursing team and a pediatrician, we're able to work with a lot of families.
I could throw in there too, in terms of diagnoses that might lead to a qualification. Certainly children with neuromuscular disorders, so spina bifida, spinal muscular atrophy, especially if they are progressive in nature, or if their neuromuscular disorder impacts maybe bowel and bladder and they require routine catheterization. That would be a skilled nursing need that would justify services for PPEC.
Thank you for adding that. Again, the nursing aspect is why I asked you to be here, because I can't speak on that like you. All right, so we'll go to the next slide. And feel free, if you have questions while I'm going through this, feel free to put them in the chat, and we can answer them as we go. Here, what are the benefits? I can go on all day about the benefits. One, we're a one-stop shop. You can get the nursing care and therapy services all under one roof without having to go to multiple appointments throughout the week, multiple visits. A lot of our kiddos get 2 to 3 times a week for each therapy discipline. So speech, occupational, and physical therapy. We even have some of our centers that have music therapy, and we're working to get that incorporated in a lot of our other centers. And you'll see that there's other providers that do the same, and they're incorporating those things as well as some work with ABA companies as well to bring that service in. And it's all about what's best for the child. The other big benefit is increased socialization with others. whether that's other children, the staff, that child is not stuck at home in one place all day long. They're getting brought in by a bus, they're getting brought in by the parent, they're seeing all these different people throughout the day. And truly, I say it, and it might be in one of the later slides, it's a village. Our whole center is a village for the child and the family, and everybody from the bus driver to the kitchen person to the cleaning person, they all build relationships with these children. Come Christmas time, they're getting gifts. Come, birthdays, everybody celebrates the birthdays. They have the child truly has a family away from their family. Another benefit is the decreased hospitalization. Being cared for by a team of nurses all day long, as well as a therapist, they can start picking up on things and also have contact with the doctors. If there's something they're seeing within that child's or out of that child's norm, if we're getting on the phone, and Becky could probably speak to this more often, she's calling the specialist, she's calling the primary pediatrician to get some clarification and see what they suggest for this child. Would you add anything on that?
Just yes, to definitely highlight that we both, our administrator, Michelle, and myself spend a lot of time on the phone with the various insurance nurses, CMS nurses, doctor's office, your primary care, your specialty care, trying to make sure we like to say that the left hand is talking to the right hand, that there's some coordination of care, that everybody is on the same page together. And again, just this week, we have a couple of children that we had to reach out to pediatricians and specialists and say, hey, we're concerned about XYZ. Are you all aware of this? Do you think this child needs a referral to investigate this concern further? And a lot of times parents don't know which specific doctor they need to turn to when they're recognizing something that might be a problem. So that's where we come in and say, yeah, this isn't right. This needs to be addressed. Let's address it on the front end before it becomes a really big problem. So always advocating for these children, and that advocacy is what keeps them out of the hospital, because we're preventing the problem before it becomes a disaster.
I love how you put that. And that goes along with the next bullet point is the personalized case management, ensuring your child's getting the best care. So when you're having someone in the middle, being able to make sure that everybody's on the same page and everybody is understanding of what is going on, it really helps the outcomes and keeps the child, out of the hospital, and the ability for you to not have to worry about that. And then also the ability for the parent to go either back to school, return to work, or just have some time for yourself. We totally understand how demanding it can be to have a child that is medically needy, and it comes with a lot. And it also, you have that, a lot of times you're the only person that's cared for your child and the only person you can trust. So we understand that it's going to take some time to build that trust. So we're open to starting things off, slower, a couple days a week to get the therapies, and open it up to full time as you get more comfortable. And each one of our centers operates a little different, but typically, we're open to helping you feel comfortable leaving your child someplace. And there's so many things in place as far as, you get, at the end of the day, you get a note home about your child's day. You have an online portal to see the different things and the therapies that they received. It goes a long way when everybody's able to communicate. Communication is a big thing. And that online portal that we utilize is very beneficial in that aspect.
I can throw something else in there too, just that speaks in terms of the comprehensive nature of the services. A lot of our kids have several pieces of equipment that they travel with on a regular basis, whether it's a suction machine or a pulse oximeter, just lots of pieces of equipment, a feeding pump. And sometimes it's our nurses that notice first that a piece of equipment is starting to fail, that it's not working as it should, it's not working properly, and it needs service. So, in addition to reaching out to pediatricians and specialists on a regular basis, I feel like I'm almost on a first name basis with some of the DME companies because I'm calling them and saying, hey, so and so's feeding pump isn't working properly. We need to have this either serviced or switched out. And it's hard for the parents because they're at work and, the child's not with them. So a lot of times, even the DME maintenance is taking place at tender care because the DME company's coming out to us getting the children's equipment serviced or replaced so that then when they go home, they have working equipment. Mom and dad can sleep soundly at night knowing that they have their equipment to keep an eye on the child while mom and dad are sleeping and the child is sleeping, and they don't have to worry about faulty equipment because it was taken care of during the day at tender care.
And that's a great point. I mean, as well as DME, we work closely with the wheelchair companies. If there needs to be adjustment on the wheelchair, or they've got an order for a new wheelchair, we can help coordinate all those things, get them fitted for the wheelchair, and really, it's that whole village coming together for the child. Not only wheelchairs, for AFOs and braces, any type of splints. They do a lot of the fittings there with the therapists, and we're able to save you, the family, a lot of traveling, a lot of appointments, and a lot of missed time from either work, school, or just family time. So let's see. We'll go to the next one. So this goes back to the village who works. So it's not just nurses. We have CNAs, we have direct care personnel, occupational therapists, speech therapists, physical therapists. At Tender Care, we do all our own transportation. So basically, we have our own non-emergency medical transport company. And these are drivers that we've trained and we trust to transport the children. It goes a long way as far as our ability to navigate, pickup times and drop-off times and routes, as well as the ability to, if there is an issue, there'll be times where, let's say, the child's not doing well, not ready for EMS service, but probably should be seen. We'll take them to either an emergency room or not the local emergency room. We'll be able to take them to the children's hospital, make sure they're seen by the right people. There's a lot of times that, either we take them to, the child goes to a local hospital, they're not familiar, so we'll bypass that and bring them to the children's hospital. I know, Becky and I worked together for a couple of years. There's been plenty of times where I've had to go pick her up from the children's hospital. We stay there with the child until the family has arrived and the child's comfortable. The other thing, I touched on it earlier, music therapy. We have that at a couple of our centers, working on getting that implemented throughout each center. We also, each school district's a little different, each center's a little different, but we do work with the education part as well. And we have teachers that come through the hospital homebound program through the school district. And these children are getting their education portion as well. So not only are they getting all their nursing services, they're getting that educational piece. And it really helps bridge the gap between school and nursing care, because one, private duty nursing is probably not always going to be able to send that child to school, or send that nurse to school with the child, where we give the opportunity for them to come see the child at our facility. And then we have different programs and different, each center, again, I talk about tender care a lot, but a lot of other PPECs have educational portions to their program where they're getting children ready for, kindergarten, or they're getting them ready for those educational pieces. So it's not just the socialization, they're also getting stimulation throughout the day as far as education. We'll go to the next one. So, a lot of you probably wondering if again, if you join late, I think we have 84 people on here. PPEC stands for Prescribed Pediatric Extended Care. And the core model of it is a 3-to-1 patient to staff ratio. And it's not the one-on-one home nursing scenario, but you're getting, with that 3-to-1, you're getting a multitude of nurses, CNAs, and people with eyes on your child throughout the day. We have the ability, like I said earlier, we're not gonna call out. You're not gonna miss something because we couldn't show up that day. We're gonna show up for you. We offer consistency and care, and besides that, we offer the therapies while they're there. And at the core of our model is the plan of care. Each child gets an individualized plan of care that's enrolled. And these plans of care, they are coordinated between the pediatrician, each specialist the child sees, and then our team. And, Becky could probably speak on that a little bit more, but we make sure we gather all the medical records so we get a complete picture of your child. And that plan of care is crafted specifically for your child, and the skilled nursing services they're going to get throughout the day, and all the parameters that go around your child, and it's updated. It's resubmitted to the doctor every 6 months, but it's updated throughout that 6 months as things change. And as we talked earlier, that coordination between the specialist and the doctor. I can let you speak on that a little bit more if you.
Yep. So at admission, a plan of care is created. And like Thomas said, it's based upon the information both the family gives us and all the information we obtain through the variety of providers that the child is seen by. And yes, it is, I like to call it a living document, because that plan of care, every single time that child goes to see a doctor, we obtain the medical records from that encounter and summarize those in the plan of care. And that's what drives the orders that are in the encounter notes from the providers, as well as the nursing interventions that are prescribed for the child. And then, yes, at the end of 6 months, we submit that plan of care back to insurance to have them decide if the child still qualifies for PPEC services. Some of our children will qualify until they age out of PPEC. And some of our kids eventually, like Thomas was speaking, of his own personal experience, sometimes they grow out of needing PPEC services. And while that's sad, sometimes in some ways we miss them, it's also a reason to celebrate because they don't need us anymore. But we're here for them for as long as they do need us, whether that's 6 months or 20 years.
Yeah. And, we want the child with us as long as it's beneficial. We've had children, mine specifically, didn't qualify anymore. But we've also had children that were with us from the NICU at birth, and then they came to 2nd, 3rd grade, and we were able to transition them on school level to 3rd grade, to 2nd grade. And we take a lot of pride in that, because that means that we have done right, not only for the nursing care, but as far as the educational aspect for that child. And, my wife works with the children, a lot of the children at one of our centers in the school program. And, she's probably said it best, and I'm going to misquote it, but, it's sad to see them leave, but it's amazing to watch them grow. She said it a lot better. That's not how it was said, but to watch them go and go beyond us and flourish in other settings it's a wonderful feeling. It goes a long way. Not only does the nursing plan of cares get updated every 6 months, but so does the therapy plan of cares. So each therapy that the child gets, they're going to be evaluated at the start for physical, occupational, and speech therapy. And, whether they qualify or not will be determined on that. But every 6 months, they're getting requalified, and they're getting new goals, and they're getting new things. we've witnessed children that have started walking that they said might not walk. When you get to see that, that's something you'll never forget when they start taking those first steps. And it's incredible. As well as we get to see children start working with communication devices and start talking through the tablet and give them a voice when they didn't have a voice. And when you get to see those things, it's unforgettable. And I think that's what drives a lot of the passion that I have behind what we do, and how I get so excited about what we do and how we can make a difference. Everybody is still with us. Everybody doing good. Give us something in the chat to say you're still with us, or if there's something that you had a question for, you can wait till the end, or you can ask it now. I'll be glad to continue on with this. All right, so we talked about transportation, and a lot of PPECs offer transportation. Some do it on their own, some use another company. We found it most beneficial to use our own, and we provide our own transportation. It's our drivers. We've trained them. We can trust them. We know that they are accountable to us, and that we feel like helps bring everything along within our model and ensure that we're on time, we're showing up when needed, and these drivers are continually trained and monitored by us. And each one of our vans is equipped with wheelchair accessible ramp, and we can put, depending on the van, 3 to 4 wheelchairs on it, as well as the vans have one of our escorts. Depending on the acuity of the child, it's either going to be a CNA or a nurse, an LPN or an RN. And that gives you some comfort knowing that they've got that medical professional with them while they're traveling, as well as our driver. So it's 2 staff members on every van, making sure that your child arrives to the center safe and arrives home safe.
All right, we have a question. Was curious how skilled nursing insurance billing happens since kids are in a group setting.
So this model is, it was started in Florida, and now there's about 15 other states that have it, and it's all billed through Medicaid. So Medicaid covers the services, and it's billed as a PPEC billing code, which is the T1025 billing code, and that is specifically how the 3-to-1 setting works. But they do monitor us to make sure that we follow staffing ratios. In Florida, I can speak on, you can visit ACA's website and you can look up to see if a center has had deficiencies and if they've been written up for these deficiencies and what they were. Specifically, I would say if you're looking for that, to see if they've had deficiencies, to make sure that they're keeping the medical records correctly, that they're staffing correctly. One of the biggest struggles we have is staffing, but we at our centers pride ourselves in always being staffed correctly, if not overstaffed most days. So we do take that very seriously at our centers. I can't speak for all centers, but it is available to look up to see. In Florida, it's the ACA website. In Texas, it'd probably be the HHS website. And we could send some of those websites out after, as a follow-up. So if you want to look into a specific center, we'd be glad to share those so you can see if they've had deficiencies and what they were. Some might not be might not be to the care about the children, could be administrative stuff, but medical records and staffing, I think, is one of the biggest things you need to look for in those deficiencies. All right. I don't know if that answered your question. Let us know in the chat if that answered your question. But that is how the skilled nursing services are. If you're in a specific state, there's a lot of states that are looking at this model and looking at the efficiency of care and how it saves, 1, the taxpayer money, and 2, the ability to care for the child, especially with nursing shortages. California has pediatric day health centers, and they are very similar, operate the similar method. There's not as many in California as there is in Florida, but I'm sure, like all places, it's a growing model, and there'll be more. If you look, or if you send us an email after, I can tell you where they are in California if you're interested for services. So questions to ask. I just kind of went through this. How long have you been in business? What is your ratio? Care plans. Like, everybody should be doing these things. Doesn't mean that they all are. Tender care. We've been around since 1988. We were the first independently owned center in the state of Florida. We've been doing this for a long time. We take pride in what we do and our ability to serve the children. And that resonates from, I think, every one of our staff members. And, some other questions you could ask, if they provide transportation. We here in Florida work with the USDA food program. So we provide breakfast, lunch, and snack for the children that attend. And that's at no cost to the parents. So, we found in our years of service that, children coming in with food and, things that were either not for their diet or unhealthy, or just not coming in with anything at all. So this helped us alleviate those pain points. We talked on this. Will you go to the hospital with my child? Yes, we've done it. Becky has done it plenty of times. It's not ideal. It's not what anybody wants, but if you can't make it and we need to transport that child somewhere, we're taking them. Hours, everyone's a little different, but in the PPEC model, they're only authorized for 12 hours a day. So if someone's offering more than that, that's not typically the norm. How often do you take the kids outside or at playtime? We believe in our centers, outside's important. So almost all of our centers have an outdoor playground. If they don't, they still take the children outside. We have one center that doesn't, but they do outside activities, and they have an indoor playground, and it's pretty amazing. It's one of my favorite places. But what therapies do you have? All centers should have physical, occupational, speech therapy. Some centers might offer other things, like we discussed, music therapy or ABA. We do work with ABA companies that come in and help the children, and we work with them. We don't specifically offer it, as our service, but we do work with ABA companies. Do you have something to add for that, Becky?
Yeah, just regarding the speech therapy, I can speak for our facility, and Danellen, our speech therapist also does feeding therapy. And so for many of our pediatric patients, that is a huge plus for our speech therapist to also be able to provide feeding therapy.
Yeah, and that's a thank you for adding that, because that is a big question we get asked. A lot of the children, as they're younger, they're going to have feeding difficulties, and having the speech therapist that can help facilitate those therapies is very valuable. Another question, do nurses have experience with the diagnosis my child has? I would say in most instances, yes. Every diagnosis is a little different, and there's different diagnoses, but a lot of them have similar aspects as far as care. Go ahead, Becky.
So what I was going to pop in with that too is, again, speaking for our facility, before any child is admitted, once their plan of care is created, it's submitted to insurance, and we get the approval that this child does qualify for services. At our facility, we circulate your child's plan of care so that all of the nurses and CNAs, DCPs, all read your child's plan of care and are aware before your child ever comes through the door what their diagnoses are, what their risk scores are, what their goals are, what their interventions are. They know before your child rolls through the door what we're going to be expecting and what we're going to deliver.
And that that comes invaluable at times. That way, when that child's starting, that our staff is prepared and we're ready to take care of that child, and hopefully give the parents some peace of mind, knowing that one, that the team has went over everything and they're gonna be familiar with what that child needs. What medical equipment do we use? It really depends on the child. Most of our nurses are familiar with a lot of the medical equipment. I know that there's a multitude. Maybe Becky, you could say a little bit more on that. But I know that the constant oxygen concentrators. They're familiar with all feeding pumps and the difficulties that go along with the feeding pumps, the little nuances and
well, like and honestly, sometimes the DME companies, I know with one of the newer feeding pumps that can now deliver the pouched formula, we discovered some of the little quagmires or glitches with the feeding pump before the DME company even realized it, that there were different colored cassettes that went with different thicknesses of food. And we had to call the DME company and say, hey, this food that you're dispensing to this child does not work with this color cassette for this feeding pump. This child needs this color cassette. So yeah, but as fast as new DME equipment comes out, everybody just has to learn and acclimate, and there is a learning process to it. But again, we work so closely with the DME company that we're fortunate. Usually the DME company can come out the same day and resolve whatever the problem is. So,
and also if we have a child that's starting with a new piece of medical equipment, they will come in and do an in-service on that equipment. And if we're not familiar with it, or even if we are, if there's different nuances with that equipment, we do have the DME company and come in and do an in-service for our staff and train our staff on that.
Especially for ventilators. Especially for ventilators. Most of the other equipment, feeding pumps, suction machines, pulse oximeters, I mean, that's pretty standard. But if we're having a child that's coming in that is vent dependent, we always have the RT from the DME company come out and do an in-service, even if it's a vent that we have used before. It's always great to have a refresher. We might have an employee working for us now that wasn't working with us, when that last child with that vent was there. So yes, we always have in-services for sure if it's a vent patient.
Thank you for adding that. We'll go to the next page. That didn't. Does it look right on your screen? Yeah. Okay. All right. So what do PPECs look like? This is one of our school rooms. Everyone's a little different, but we do, try to have that dedicated space for a learning environment away from the rooms. Cribs, beds, depending on the child, everybody's going to they'll have their own individual space where they're resting. Each child cares a little different. If they do need to use a bed, they have their own dedicated space. We have housekeeping that is making sure that sheets are changed. We have everything in place to make sure that we think about infection control and anything that would compromise the child's immune system. Each center is a little different, but some have dedicated feeding areas, cafeteria areas, or spaces that they're going to have those meals throughout the day, and then also a playground area. And that's something we do and make sure that all of our centers have either an outdoor and indoor play area that is workable for the children. And we find that play is a big aspect of that, and even just not playing, but just getting outside and getting that fresh air. Let's see. She's one of my favorites. How to enroll. Most PPECs or prescribed pediatric extended cares will help you with the enrollment process. You either call or fill out a form on their website. I encourage you to take a tour. Not some areas have a lot of PPECs, some don't. Every area is a little different, and but I would still make sure you take a tour and make sure you feel comfortable. Make sure that your concerns are being addressed and that you feel heard. I could speak for tender care. I could tell you your child's not a number to us. We truly care and have our hearts in what we're doing. As you can see, I get excited about talking about it. I did earlier, and it really, that goes from me down to everybody, I think, in our facilities. All right, some of the difference between PPECs and home health, and went too far. Let's go back. PPECs get socialization. We do field trips sometimes. All of our services are covered by Medicaid. We offer schooling. We could offer a higher level of monitoring depending on what that child could get at home. We have multiple nurses, multiple people to talk about what's going on. We actively coordinate the care with the child between the pediatricians, as we spoke earlier, and the specialists. And we have activities in playgrounds. We get at Christmas time, Santa visits, brings presents. Each child gets a picture with Santa. We do Halloween where they go trick-or-treating between the rooms and the different places at the center. We do a parade through the area with their costumes, so they get that whole experience. We do work with home health companies and private duty nursing though as well for those children that need 24-hour care, where we'll coordinate to make sure we're dropping off and picking up from a nurse, where we coordinate the care, make sure that everybody's on the same page again between the home health nurse and our nurses. The one benefit is, private duty nursing is covered by more insurances and some private insurances, where PPEC is mostly covered by Medicaid service insurance. Did I miss anything on that point? All right. Any questions? You guys got questions? All right, here's a map of the states that currently have PPEC. Most of it's in the South, but like I said, there's other states that are getting the model. And I spoke in front of the legislators in Virginia, and I can tell you in Virginia in 2026, they're going to start licensing PPEC centers. I can tell you Ohio, it's currently being approved this session, and Missouri as well. So the model's growing, and I know there's some other states as well with it on the radar. Texas is one of the states that recently adopted the PPEC regulations, and currently there's 10 in the state, but I know for a fact it's growing. There's a lot of companies interested, and they definitely see a gap in services and the need for care in Texas. Florida is got the most, as you can see on that map. We operate 6 centers in Florida. We're working on a center in Texas, and we're always, it's not always about us. If your state is entertaining this and they want to speak to people that have been in this model for a long time, I'm happy to speak to legislators, people within the government, people within the healthcare system, how our centers benefit the child and the family. Everybody still with us? I think so. We're still 80 participants. I thank you everybody for showing up. It means a lot. And we'll continue doing these if you guys think it's beneficial, have other questions, how we can help or better put this on next time. And again, we're here if you have questions. Here are some of the centers in Florida. Us, obviously, there's a lot of other great facilities. Kentucky is a big center or a big state that also has it. We work very closely with the Kids Club in Kentucky. They're great people. You can take a look at some of these names and some of these other places. If you're in South Florida, you've got your options. But just make sure that they're doing things right. And again, take a tour, talk to people, talk about the location, make sure it fits you, make sure it fits your family. Everybody operates a little different, ask questions, look up their deficiencies. And again, if you're not in one of our service areas and you want to be put in touch with one of these people, feel free to message us. We've got a lot of connections throughout the industry, and we'll put you in place with a PPEC that we feel does things right and is, I don't know how to say it politically, is doing the right thing by the family and the child. Yeah, I spoke on this a little bit earlier. What makes us different? We've been doing this since 1988. Just to put it in perspective, my wife's grandfather started the first PPEC that was independently owned in Florida. There was 2 places getting licensed. He helped them get their license and said, well, do you mind if I go ahead and I'm going to start one in Fort Lauderdale, and that's where we opened our first center. Since then, we've grown to 6 locations in Florida. We're always looking for new opportunities, and we've seen the need in Texas, so we're going towards Texas as well. Hopefully, have our license there in the next month. But there's definitely some centers that operate in Texas that are great. We're part of the Texas PPEC Association to help the model survive there. And also, we just started our own PPEC coalition in Florida for like-minded centers that are doing the right thing and want to make sure that we raise the standard of care in Florida and everybody is doing things the right way. And we really want to make these centers flourish and, make it not about us, make it about the outcomes, the access to care, and how to do things the right way. What sets us apart, I've said it multiple times throughout this, we care, we treat every child like family. We have passion, our hearts are in it, and we truly have a desire to see them succeed and to see the family succeed, whether that's mom going to school, getting, we've had parents that have went to school for nursing and now they're nurses. We've had parents that have went and done other things, and you finally have that ability to go shopping and go to the grocery store and not have to worry about your child. Giving you peace of mind is one of the big benefits of what we do and what we're here for. Here's our centers in Florida. Let's see. You scan the QR code and visit our website. Anybody have questions? Let's open it up to questions. I know I've asked a couple times throughout, but I've got 79 people on here. Let's see if you have any questions. Put us to the test. Glad to help. Becky's here for the nursing questions, and otherwise I could keep talking about what we're doing and the vision of where we're going with the PPEC model. I'll give you a couple minutes.
Yeah, while people are thinking and digesting all that information, because I know it's a lot of information to take in, I'm just assuming that a lot of people on here aren't familiar with PPECs and also they don't know where to start. So can you just go over exactly this, step by step how they can start to enroll their child into a PPEC? Do they go to their doctor first or do they go to the PPEC first?
Yeah, I mean, you could discuss with your pediatrician. I think that's a great first step to see if the care model would work. You could also contact us, and we do all the legwork. We contact the pediatrician, talk to them. We get that order a prescription for services. Again, the PPEC stands for Prescribed Pediatric Extended Care, so it's got to be prescribed by a physician. But we take care of all of that and then start getting medical records. So you come to us. We ask. Typically, I like to say it's good to take a tour first so you can understand the care and the model and how things are done at the center, and then you have to make the decision if that's right for you and your family. And then we'll get some medical history from you while you're there, and start developing that plan of care. We try to get a nursing assessment if you bring the child for the tour. If not, you can bring them back and get that nursing assessment. The typical process, depending on the pediatrician's office, could take 2 to 3 weeks. Sometimes could take a month or more with some pediatrician offices, because we have to fight in tooth and nail to get some documents signed. But hopefully we start making a little headway on that. So, they understand that it's about nursing services for the child and for the family. They shouldn't have to wait that long.
All right, well, I don't see any questions coming in, so maybe we can just wrap it up. And if anyone has questions, you can reach out to us after this webinar through email.
Let me see. So I appreciate you all joining and coming on. Did I kind of explain the model and the things? Did I answer questions you might have? How can we do things better in the future? I'll give you a couple seconds to answer. And, it's okay. I don't bite. You can ask away. Becky, did I miss anything throughout the presentation? Anything you'd like to add?
I don't think so. I think you did a really good job covering everything. I'm excited because I see that someone was watching us from California, and I'll be quite honest, I had no idea that this was spreading that far. I thought this was just a Florida thing. So that's really cool and really exciting.
It really is. It's really exciting to see that other places are seeing how the service can help, and how, one, it's great for the families. It's also great for just the medical system in whole, because we're able to coordinate that care, and we're really able to bring everybody together, especially someone in your position that you spend daily talking between specialist, pediatrician, and therapies and everything. It just really getting that whole picture of that child and what the child needs. All right. Well, I guess I see people dropping off. I appreciate you all coming. Please feel free to email us, contact us. We'll send out some information after this. And if you have any questions, just let us know. Happy to help. If you want to find where there's a PPEC center near you, I'll be glad to point you in a direction of someone that you can trust. And thank you again.